Okay, so you have two students, same grades, same UCAT score. One gets the interview in their place at medical school and one doesn't. What's the difference? Well, it's not just what work experience they had, but how they used the work experience that they had under their belt. So I'm going to break down the misunderstandings between what applicants think that they need to do with their work experience versus what the universities and the selectors actually care about. And I'm going to go through 6 things that highlight the differences. And at the end, I'm going to show you kind of like a framework to think about it, or like a step of things to consider as you're reflecting through your work experience to get the most out of it. So the first one that we see, with 1,000 students that we help every single year, they do the right things but get the wrong value from them. And the first one that we see is that they think it's about the quantity of the experience that they get. They feel like they need to reel off a laundry list of things that they've done and just like tick off a load of stuff, and that's going to be more impressive. So they'll collect all of this list, like hospital days, GP placements, shadowing, volunteering, and bar very few universities, really selectors are not counting hours. They don't want to know what numbers you've racked up. What they actually assess is insight. What did you actually observe? What did you learn about the patients and the professionals you saw? How did it shape your understanding of medicine? With our students on the Future Doc program, we regularly see people with only 2 or 3, but well reflected on work experience placements, way outperform people who've racked up 10 plus. So remember, experience without insight is basically invisible. Just remember the importance of reflection. Number 2 is that applicants will try to impress, whereas admissions care about understanding. In other words, the mistake is trying to sound impressive. Students will say things like, I witnessed a really, complex procedure, or they'll say, they'll name drop a hospital or a professor or somebody that they think is going to impress the uni selectors. But that tells university selectors nothing about you. They want to see that you understand what you're getting yourself in for, not that you just simply admire it. They want to see that you understand the emotional demands, the communication challenges, the realities of teamwork, and the limits of medicine. Simple, honest reflections where you really elicit the juice from what you were supposed to learn from that experience often score a lot higher than big dramatic ones. Number 3 is that applicants will describe, whereas admission selectors really care about reflection. Again, this is a variant on a theme, but let me give you some examples of some answers that students have given and how we would amend them to really make them fit the criteria that we want. So one student said, I shadowed a GP and observed consultations, but really that doesn't tell us what it is you got out of that and how that's going to impact you being a great doctor. I would encourage you to go for to follow the formula of what you did, what you learned, and the most important thing is how that will influence you and make you a better doctor. Now that could be that it opened your eyes to something, it showed you the value of a trait, it gave you an area that you need to focus on to improve, it gave you a way of communicating that you will carry forward as a doctor and in how you approach your patients. Whatever it is, in any way that it contributes, that is important reflection. So when we amended this sentence to make it more reflective, we said something like, I noticed how much of the consultation focused on reassurance rather than diagnosis, which changed how I view the whole communication in medicine and will make me adapt how I communicate with patients in the future to improve their outcomes. Number 4 is that applicants think that only clinical experience is what matters, whereas admissions panels care more about relevance and transferability of skills and traits. Many students think that only clinical work experience is valuable and anything else doesn't count, which is a mistake. It's all about what you can get out of it and how you can apply those lessons. It doesn't matter whether it's a care home, volunteering experience, or maybe even a customer service role in a restaurant, or how you do your extracurricular activities, managing a group if you are the head of a society, for example. It's all about the skills that you can get out of it. They're looking for signs of empathy, responsibility, communication, professionalism, not just proximity to a stethoscope. We do a great work experience playlist that you can access here, which goes through all the elements that build a good work experience portfolio, if you want to call it that. We have a medicine one and a dentistry one as well, and that will give you everything that you need to know to build a good mix of work experience. Number 5 is that Applicants think that work experience is just about what you're going to write in your personal statement, whereas the admissions panels and the people who are seeing it properly, they understand that it's connected throughout everything that you do. You will have heard me say in other videos, work experience forms the foundation of your application. Not only does a good base lead to more experiences, more insights, and more understanding, it helps you understand everything from the ethical SJT part of the UCAT to writing personal statements, but also to interview as well, and the kind of questions that you get asked and how you answer them. I have backed myself out of many corners during interviews, just pulling on questions that I could have never prepared for, but having the experience and having real life examples of the questions that they were trying to ask me so that I could give a really high quality answer without even preparing, because I'd almost pre-prepared by doing the work of getting great work experience, but more importantly, reflecting on it and thinking about what I've learned from that moment. But medical admissions don't see it that way. Your work experience fuels interview answers, ethical reasoning, motivation questions, and how authentic you sound under pressure. At FutureDoc, we see people's interview performance improve quite quickly once they understand the reflections and what they're supposed to be getting out of their work experience, and they will come across a lot more naturally because of it. Because if you can't talk about your work experience naturally, then interviewers will notice. And then finally, number 6 is that applicants stop reflecting the moment the placement ends, whereas admissions tutors want to see long-term insight. In other words, as you gain more and more experience, that will give you a different way of seeing and thinking some of the previous things, and they all start to get connected, and your kind of collective maturity and understanding of everything as a whole starts to become elevated, and you clearly become more experienced and more mature as a result of the product of all of these things that you're doing. Work experience doesn't just end when the placement ends. The strongest applicants continue reflecting weeks and months after. They connect experiences to ethics, healthcare systems, patient safety, and their motivations for medicine. Reflection and experience compounds over time, and admission tutors, I can speak for myself, can tell when people have allowed that to gradually build and steadily build to someone who has made themselves the real deal versus someone who has rushed it last minute, which is another reason why it's so important to start your preparation early. So here is the shift that you need to make. Less collecting, more reflecting. Less impressing, more understanding. Less describing, and more insight. Work experience is not about proving how close you got to medicine. It's about showing that you understand as much as you can what you're getting yourself into. If you would like some help with your medical or dental school application and build a really great mix of work experience that's going to get you into your chosen university, the FutureDoc program is here to help you. If you want to find out more, you can check it out here and see how we can guide you through the entire process to maximize your chances of getting in and help you write your own story.